So I'm definitely going to read from the script, and it says here to warmly welcome attendees. So, hey everybody, happy Recovery Month. We appreciate you being in person. We appreciate those who have been able to tune in online. For everyone I have not yet had pleasure of meeting, my name is Keegan Wicks. I'm the National Advocacy and Outreach Manager with Faces and Voices of Recovery, and it is an honor to be your MC here for the day's extravaganzas. And so we do have a packed agenda, and so things are gonna go pretty rapid fire. We're first gonna start out with a game of really intense musical chairs. So if everyone could stand up and run, okay, please don't. But those of you that are viewing in from home, please do. Okay, so this luncheon serves to kick off Recovery Month, an annual observance that has existed since 1989, which is really hard to believe that we've been able to continue to celebrate and observe this, this really enlightening moment in time that we have opportunity to celebrate the pillars of what makes recovery possible. And so really trying to focus on promoting evidence-based and evidence-informed practices, recognizing the dedication of service providers that operate tirelessly across country day in and day out to ensure that people have outcomes that are recovery-oriented, and of course raising awareness and reducing stigma around substance use disorders and mental health. I also want to take a second to acknowledge that as we start out this month in September 5th, in case anyone's like, wow, what day is it? At the bookend of the month, September 30th, we have International Recovery Day, which is a global convening and a global connection point to stand to celebrate recovery in a 24-hour span of time. I encourage you to go on internationalrecoveryday.org to register for your own individualized firework, where we'll all have an opportunity to light the world purple in a single moment in time. The exciting part about that is that though you have opportunity to get out, and you should get out to be a part of your communities during September, there's always an opportunity to tune in remotely from wherever you're at. A couple of housekeeping items. So hopefully by now you've all discovered where the restroom is, but if you have not, it is my pleasure to tell you it's right out these doors all the way to the back hall on the right. But perhaps more importantly, you may have noticed that there are some pins that have been very painstakingly set on your desk or table. And these are cool because they're dry erase pins where you have opportunity to plug in what recovery is for to you, so that you have opportunity to wear recovery proudly as you navigate the month, whether you're an ally, whether you're a person with lived or living experience, or anything in between. You're welcome here. Second, if you have noticed some badges have a golden ticket on the back of your, okay, they don't, but they have dietary restrictions. If you have identified yourself as a person who needs dietary restrictions, just make sure that you show that to individuals when they are serving lunch, so that way we can make sure you have the correct meal. It would be cool if we had golden tickets though. And we have a really exciting lineup today, and fortunate to have the Office of National Drug Control Policy, the Substance Abuse and Mental Health Services Administration, alongside some really awesome guest speakers with us here today. And then we also have opportunity to present the Ramstead Kennedy Award for this year's Recovery Month recipients as well. And so all things to say, we're appreciative of you all being here, both in person and online, because it just simply wouldn't be possible to celebrate recovery and celebrate Recovery Month without the people involved that make all of this possible in the first place. A special thank you to all of our sponsors who have been able to help us make this event possible and get us started as we go about the day's activities. And I would like to extend it, and I'll try to remind you as we go throughout the day. Once we finish the luncheon, that doesn't inherently end the day's activities. We're fortunate to be able to have a recovery walk directly after this that's convening at Freedom Plaza. So more to come. Please join us on that walk. We would love to have you. SAMHSA has been an incredible partner in spearheading this initiative and really trying to dedicate space to have a recovery walk here in DC. So I have opportunity to show you some brief welcome remarks from our Chief Executive Officer, Patty McCarthy, who's unfortunately not able to be here with us today, but she certainly wanted to make sure she shared a few words. So without further ado, Patty McCarthy.
Good afternoon, everyone. It's wonderful that you're all here as we kick off Recovery Month with this special luncheon. On behalf of everyone at Faces and Voices in Recovery, I want to extend a heartfelt welcome to each and every one of you. Unfortunately, I'm not able to be there with you today in person because I tested positive for COVID earlier this week and I want to keep everyone safe. But I certainly wish I was there and hope that you enjoy this time together. Recovery Month is a time to celebrate the progress we've made, honor the resilience of individuals in recovery, and recommit ourselves to the vital work of supporting those on their journey to healing. Today, as we gather, we're not just marking the beginning of a month of awareness and education. We are coming together as a community united by a common purpose. This month is a testament to the strength and courage of those who face the challenges of addiction and mental health head on. It's also a time to acknowledge the tireless efforts of families, friends, and professionals who provide unwavering support and care. Your presence here today is a powerful reminder of the collective effort it takes to build a supportive and inclusive environment for recovery. We have an exciting lineup of events and activities planned throughout the month, and I encourage each of you to take full advantage of these opportunities. Whether it's attending the Rally for Recovery, a recovery walk, or other recovery community events, or simply engaging in meaningful conversations about recovery, your involvement is crucial in spreading hope and fostering understanding. I want to thank our esteemed speakers, our generous sponsors, and the Faces and Voices team for their work to make this event possible. Thank you for being here, for your commitment to this cause, and for your dedication to making a difference. Let's make this Recovery Month a time of inspiration, connection, and progress. Have a safe, healthy, inspiring, and impactful month ahead. Take care. Thank you.
Thank you, Patty. We're sending you speedy recovery as you get well soon. Okay, so our first presenter here, I have the honor and privilege of being able to introduce Dr. Rahul Gupta, who's the director of the Office of National Drug Control Policy, who throughout his time in this role has embodied the dedication, expertise, and innovation of what it looks like to really engage with recovery from addiction alongside his time with the administration and throughout his career. Dr. Gupta is, as many of you already are aware, the first medical doctor to serve as the director of Office of National Drug Control Policy. ONDCP is a crucial component of the Executive Office of the President, coordinating our nation's drug control strategy that comes out annually and federal policies on prevention, harm reduction, treatment, recovery support, among others. Dr. Gupta is not just an administrator, he's a practitioner who has dedicated his career to improving public health and safety roles that span local, state, and federal. With over 25 years of experience as a primary care physician, he's served communities ranging in size from small towns of 1,900 residents to bustling cities of 25 million. As the West Virginia Health Commissioner, Dr. Gupta has led groundbreaking health initiatives like the Neonatal Abstinence Syndrome Birth Score Program to identify high-risk infants and the groundbreaking statewide social autopsy, which examined the lives of overdose victims to determine the factors that led to their deaths and perhaps more importantly, what could have prevented those deaths in the first place. Dr. Gupta has been honored with numerous awards, including Public Health Official of the Year in 2018 by Governing Magazine. And Dr. Gupta is a thought leader who practices what he preaches. Under his leadership, the Office of Drug Control Strategy has further embedded recovery, support services, and harm reduction programs, and medication-assisted treatment services for people with opioid use disorder, has been instrumental in expanding harm reduction programs. Dr. Gupta's multifaceted career makes him uniquely qualified to address us on today's topics that sit at the intersection between medical practice, public policy, and community well-being. Please help me welcome Dr. Rahul Gupta.
I was told this is mandatory. Well, thank you, Keegan. Really appreciate it. And hello, everybody. I bring you greetings from President Biden and Vice President Harris. And it's so wonderful to be here to see everyone and celebrate the millions of Americans' lives in recovery. Really a proud moment. I'm also so happy to see colleagues from across the government, nonprofits, and others in partnership. It's really wonderful. And as Keegan mentioned, we wish the best for Patty. We cannot wait for her to recover. We also want to congratulate this year's winner of the Ramsey Kennedy Award, which none of us know about, right, so far. So it is hard to believe we are already in the recovery month. We're literally a couple of months away from a major event in the country, and not that I'm counting. And I will tell you, it doesn't feel like it's been a year since we were all gathered here. I know that Patty and Keegan and the Faces and Voices team, that you all work so hard, and you're probably thinking, do you have any idea how much work goes into the planning and lunch for a full month of events? So let me say on behalf of all of those and all of us who have the privilege of just showing up and being here, thank you. Thank you to the team. Thank you for your leadership. Thank you for all your work that you do to make this event such a success year after year. Let me just make sure that we take this opportunity to acknowledge and recognize not just the leadership in Patty and Keegan, but also all of the people that are working hard behind Faces and Voices with a round of applause to be here. And folks, while Faces and Voices does a lot for the cause, this is a team effort. And you know that, whether it's across administration, Congress, advocacy, states, communities, we're all working towards the same goals. And I will say once again this year that President Biden has declared September as National Recovery Month. You have on your tables a copy with a very nice ribbon of this proclamation at your seat, so please don't forget to take that. You can always frame it. I'm going to have a nice framed, one of the best ones in the afterwards that I'll present. Let me just read an excerpt from what the president wrote. People in recovery exemplify courage, hope, and resilience as they seek new beginnings and help countless others find pathways to healing. During National Recovery Month, we celebrate their contributions and we honor the loved ones who have supported them on their recovery journeys. We also reaffirm our commitment to making sure every American has the resources they need to recover and thrive, and to helping them live long, successful, and healthy lives. Let me repeat the last piece. We reaffirm our commitment to making sure that every American has the resources they need to recover and thrive. And let me tell you this ironclad commitment from President Biden and Vice President Harris began on day one. When they came into the office, our country was facing devastating increases in overdose deaths, more than 30% year after year. And we made a commitment and an intentional choice to take on this crisis and hit the ground running to deliver the change that we all need. Now, over the past 3.5 years, the Biden-Harris administration has taken more historic actions, which you all have been a part of, invested more money than ever before to address this crisis head on. Now, we've focused on going after the two key drivers, primarily untreated addiction and the drug trafficking profits that fuel it. I'm going to talk a little bit about each of those and give you a report card of sorts. And really, thanks to the leadership of President Biden and Vice President Harris, and the support of people that are right here in this room and across the country, that we've made so much progress. So let me sort of state some of those things because they need to be stated. They need to be said. Naloxone is now available over the counter. There are now 15 times more providers who can treat opioid use disorder, making treatment easier than ever to get access. Funding for treatment is up 40% over the past administration. We're expanding treatment in prisons and jails so people who are in custody can begin their recovery journey before re-entering the community. We're building a recovery-ready nation that helps people get their lives back and contribute to their communities. We're reaching more youth, more educators, more parents about the dangers of fentanyl and the life-saving power of naloxone. And we're sending record funding to states and tribes to prevent overdoses and substance use disorder. We're also catching record amounts of fentanyl at the border and installing cutting-edge drug detection technology to catch even more, and calling on Congress to provide those critical resources to make that happen. And we're going after drug trafficking profits that are fueling the crisis, including the finances of cartels, the Chinese chemical companies, accountants, lawyers, brokers, and so much more. Let me tell you this, folks. It's making a difference. You know, recently, for the first time since I've been in this profession, you've seen the overdose deaths go down more than ever before when you look at the 2023 provisional numbers. More people are still at dinner table each night and are still here to celebrate birthdays and holidays and life's most important moments. Now, we know that there's so much more to be done, but this is important progress. It could not have happened without the folks here in this room. And let me tell you, there's so many thousands people like you out there that are working in communities across the country to save lives and making sure that people get the help they need when and where they need it. And recovery is such an important piece of the puzzle, such an important piece. So let me take a few moments to talk about our work, the work we're doing across government to build a recovery-ready nation. You know, a while back, I joined my good friend, then Labor Secretary Marty Walsh, on a visit to New York. And we met a man named Ivan. And I still remember that meeting because Ivan told us when we were talking to him that he learned everything about addiction the hard way before receiving the support from addiction professionals, the treatment, and being in the recovery. And today, because he got the support that he needed, he has a job. He has housing, although far away from the temptations of his old neighborhood. And he has confidence again. He isn't returning to drug use because he's got the support that he needs to be successful. And you know what he said to me, which I will not forget? He said that he used to take from his mother and his grandmother all the time. And now that he is in recovery and he has a job, he is giving back to his mother and grandmother. And that was heartfelt, because Ivan's story is a great example with what happens when people get the care and the support that they need, and without having to face the stigma. Recovery and the dedication of trained and professional addiction workforce has changed Ivan's life, and it does so for millions of Americans like Ivan. And you know, President Biden, Vice President Harris, Department of Labor, we all want to make sure that we make it easier for Americans to get their lives back. That's the bottom line. So we've partnered with Department of Labor, many of you know this, and other agencies to create a recovery-ready workplace toolkit for business leaders. And let me tell you this, ONDCP is walking the talk here. I often have been in my other positions where I wish federal government would walk the talk. And I'm really proud to report to you that we are right now completing steps to be a recovery-ready workplace, and other federal agencies are also beginning that process. Now, just last week, and thanks to Peter Gamon and Dr. Cece Spitzes in our office here and the team, we held a training for staff on recovery and overdose reversal inside the office, and another training for supervisors on hiring and supporting people in recovery in the workplace. And I know that my great colleague and friend, Dr. Delphin Rittman, as well as Dr. Olson and SAMHSA and the team there have created the first ever Office of Recovery aimed squarely at building recovery infrastructure that our nation so desperately needs. And you know, ONDCP is also leading the interagency research effort to learn more about the many pathways to recovery and what kind of recovery support services work for different people, because research pathways are so important to make sure that this progress is not lost in the future. Now, you might say, and I know you're not because you understand and you believe in the work we are all doing collectively, but someone might say, why are we doing all these things? Well, first of all, it's the right thing to do. Everyone that's affected by substance use disorder deserves a second chance, and it doesn't matter who you are, whose family, whose community, everyone. Second, beating the opioid crisis is a key pillar of President Biden's unity agenda. It means that this is not a red state issue or a blue state issue. This is America's issue, and we must continue to keep it as America's issue to get the full attention. Third, it makes good business sense. It's a good thing for business. We all know that there's more than 22 million Americans who report being in recovery from a substance use disorder. 22 million, and I may be undercounting that. Now let me ask you all, does anyone know how many of those 22 million are employed? Shout out your answers. 20%, 60%, or someone who knows 80%. Well, 64% to be right, okay? 2 out of every 3 people in recovery, they're employed. Now let me ask you, how many of those are working full time? One of those figures are right. 80%. 80%. Imagine the contributions of people in recovery to the economy of this nation and sustainability of the future of this nation. It doesn't get talked about enough. So if you are an employer, you probably have people on your team who are in recovery. You also probably have employees who have untreated substance use disorder, and we know the cost of that, don't we? We know the cost of missed work days, reduced productivity, healthcare, and turnover costs. There's a real cost. And having to replace people because you're giving up your staff time and valuable staff time because you're not having a recovery-friendly workplace. And that's why we say that adopting recovery-ready workplace policy is not simply the right thing to do, but it also helps your bottom line as an employer. People again, in recovery are some of the hardest working, passionate, dedicated workers. And how do I know that? Because we have so many people working within the White House as well as across federal government. And the final reason we're doing this is because science backs up our approach. Research tells us that obtaining and maintaining a job is a critical part of many recovery journeys. A job offers stability for tens of millions of Americans in recovery or struggling with substance use disorder and their families and communities. And I'm not saying that the president is a scientist here, but the president often says that a job is much more than a paycheck. It's about dignity. It's about respect. It's about being able to look your kid in the eye and say that everything will be okay. The truth is, look, thanks to the administration's work, the federal government is supporting recovery like never before. Never before. And because of all these efforts, your hard work to improve recovery across America and the opioid crisis, it looks a lot different today than it did in January of 2021. And that's all thanks to your work and your effort. And this work is going to continue because we know that we cannot miss a single chance to save a life and get people into recovery. We can't. Now, at the same time, we haven't forgotten those that we had lost. Just last week, we recognized the International Overdose Awareness Day at the White House. Some of you were there. We spent some time with the second gentleman, Doug Emhoff, who made it a point to fit it into his packed schedule to speak with families who have lost loved ones, because the issue is so important to him. And this wasn't the first time or the second time. This is something that he really cares about, and he shows up each time there are families to talk to them, to understand the pain, suffering, share, learn. We remember in the event those we lost. We recognize the actions the administration has taken to address the crisis, and we honored individuals who are working tirelessly to make difference for people with SUD and their families. And in many cases, they're doing it even when it's been too late for themselves, for their own families. And that's courage. And that's making our communities and our country better. Because why? Because they want to make sure that they're sparing other families from that pain, from that loss, from that suffering. I know that everyone here understands this and understands this at a very personal level. The truth is that what you do to make people and their community and their families great is what makes this country great. To help those that you may not never come to know, but you know you're helping them and they know you're helping them. That's the greatness. And let me tell you, because of this work, because of your engagement, overdoses are down last year 7.5%. That means we're saving a life every hour each day around the clock. That's what 7.5% comes back to. Thousands of lives, but you're now saving a life every hour around the clock. And while we're losing way too many people than any one of us here will accept, we are making a difference. And I'm going to pledge to you here that this work is going to continue, in large part thanks to all of you in this room. And folks, let me tell you, working together is the way we're going to beat this crisis. As President Biden often says, we are the United States of America, and there's nothing beyond our capacity to do when we act together. Now, we have 25 more days this month. Done the math. So the attention is on us. And this is our chance to make sure that people know about the changes that are happening to put recovery into more reach than ever before and help people get there. And that's our job. So people can continue that work for the entire year, and then we do it again. So I want to thank you, and I want to thank you for your commitment your tireless work, your suffering and going through and making it happen for other people. It is an honor, a pure honor to be your partner on this journey. And I wish you all the success in this National Recovery Month. So let me end here before I put the glasses back on and walk off. To present a copy of President Biden's proclamation to Keegan and the Faces and Voices team. So Keegan, can you please come and join me? There you go. All right, I'll put it on. Hold on.
See, I feel like I need to put it on.
Thank you. Thank you all. You can see who runs the office.
Director, I have your notes, but I won't give them to anyone. Okay, thank you, Dr. Gupta, so much for your remarks and the proclamation, and not just this proclamation, but for providing all of the proclamations for today's event. As the salad plates are served, happy to move on to our next course of business or celebration, depending upon how you woke up today. I had mentioned the Kennedy Ramstad Award, and we're happy to acknowledge the recipient of this year's Ramstad Kennedy Award. And for those of you who may not be familiar, the Ramstad Kennedy Award was established in 2008 to recognize an SSA and their director who has demonstrated outstanding leadership in support of recovery and Recovery Month, and to acknowledge the tireless work that Congressman Ramstad and Kennedy have put in their commitment to recovery and recovery-oriented policies. Fortunately, to help us introduce and to present this special award, Patrick Kennedy himself has provided some remarks.
Thank you so much, Keegan. It's my honor to present the Ramstad Kennedy Award, named for my late colleague, Jim Ramstad, a true champion for recovery. To present this award to Eric Tadahara for his leadership on behalf of making recovery services more available to the people of Utah, and in following with the mission that Jim had, that these illnesses be treated with dignity, that we provide the latest in evidence-based treatments to those that are seeking care, that we acknowledge the fact that the disease of addiction cannot be treated in isolation. We need to treat the co-occurring, in many cases, mental illnesses, and we need to make sure that we integrate not only mental health into addiction care and vice versa, but that we integrate both of those into the rest of physical health care. We need a system where the body, mind, and spirit is taken care of, and we start by making sure that we treat the medical piece to this, but that we, through the support of people like Dr. Delphine Rittman at SAMHSA and Dr. Gupta from ONDCP, that we ensure that public policy acknowledges that to best treat these illnesses, we need to make sure that the medical approach is not the only approach, but that we ensure that the supportive housing is there, that recovery residences are supported, that we get reimbursement for recovery residences, that we ensure that recovery community organizations, opportunities for people to get supportive employment, all of these things are part of what recovery means, and we want to thank Patty McCarthy for her incredible leadership at Faces and Voices of Recovery, which is advancing the very understanding and literacy of what recovery means. We really have never supported recovery, reimbursed for it. We've never treated the illness of addiction as a chronic illness. And all of those things are things that we continue to fight for. We need to build a modern-day advocacy movement. We need to come out of the basements and really understand that our obligation to our fellows who are suffering from this disease is not compromised when we say that we are people living in long-term recovery. That doesn't betray our 12-step group. It maintains our 11th tradition, and yet at the same time, it puts a face and a voice on the nearly 30 million Americans who are living in long-term recovery, so that all of America understands that recovery is possible. Jim Ramstad lived his life trying to achieve this mission, and I'm proud to say that the law that bears his legacy, the Mental Health Parity and Addiction Equity Act, is now getting some new life in the new rule that is being released by the administration to fully enforce the Mental Health Parity and Addiction Equity Act to ensure that we have pay parity for those who are treating the disease of addiction, just as we would pay any other professional treating any other illness, that we ensure that access to treatment is no different than access to any other form of medical treatment. All of these things are going to be advanced under this new parity enforcement rule. I'm proud at the Kennedy Forum to have named our model state legislation the Jim Ramstad Act, and I'm proud to say that over a dozen states have adopted this law so that the states themselves can do an even better job at holding payers accountable. But at the end of the day, we need payment not just for medical care, as I said, but we need payment for all the social supports that can help make long-term sobriety and recovery possible. And that's why we need everyone here to rededicate themselves, as Jim would want, to the cause of his life and to the cause of, I know, everyone who's part of this great fight for equality and access to care and the dignity that goes with respecting people who, through no fault of their own, have the disease of addiction, no different than if they had any other disease, and that we need to respond to that disease with the same urgency, with the same professionalism, with the same expectations for quality and measurement-based outcomes that we apply to any other set of illnesses. And that was Jim Ramstad's goal. I'm happy to see that, Eric, that was part of your goal in Utah. And I'm so honored that you will be receiving this award. And I am so grateful to all of you who advanced this cause. And with that, I wish you all well. Thank you so much.
Thank you, Patrick. And presenting the award to Eric and the Utah Office of Substance Use and Mental Health.
Hello, everybody. Firstly, I'd like to thank just everybody for this award. This is an award that is really more than just myself. When my wife found out that I was getting an award, she asked me what I was getting an award for, and I replied to her, I think doing my job. I've worked in the state of Utah's government for the last 11 years, and in that time frame, I think one of the things I've learned is government's a thankless job. And this is a good reminder that there are reasons we continue to do this work. With that, I really want to make sure that I thank my team, the people who work with me in Utah, both in our state office and as well as the people in our community. If it wasn't for the community partners doing the work on the ground, if it wasn't for my team who is dedicated every day to ensuring that recovery is something that's achievable in the state of Utah, I don't think we would be where we are today. Within that, I really want to say that one of the things that we've strived really hard to work toward is ensuring individual voice is present everywhere when we are when we're working with this cause. We actually just started a new behavioral health commission with a goal of improving behavioral health policy and service access across the state of Utah. And we have 3 members on that commission who have lived experience, which is a huge push, and it was something that took a lot of work from not just us, but from community members in order to assure that we're not the ones as professionals guiding, but we're the ones helping to work with individuals in lived experience situations. One of the things that I would really like to just also talk about briefly, I don't like getting awards. I think this is, for me, not why I'm doing the work. The reason that I am doing the work is for the people who we're trying to help, and that includes family. Interestingly enough, I was notified of this award on the day of my cousin's birthday, who died by suicide 5 years ago. And that was both a good reminder and a sad reminder, because she struggled with a number of issues, ranging from her mental health and some substance use need, and it is what ended up leaving or causing her to die by suicide. And if it wasn't for people like that and the people in my life that I strive to work for, I don't think that this work would be as meaningful as it is. I have constant reminders, and I think this is just another great reminder. So I just want to say thank you to everybody here. Thank you to Faces and Voices. Without any of you in this room, I don't think this work would happen the way it is. And it's not just about what happens in Utah, it's about what happens across really the world, because I think we all know or have personal experiences with recovery, with suicide, with other issues. So thank you. Thank you very much.
All right, look at us rolling along. Our next speaker, I have to take away from eating their lunch, and so I apologize promptly for such an experience. But please let me introduce our next speaker, Dr. Miriam Delphin-Rittman. Dr. Delphin-Rittman brings a wealth of knowledge and experience in evidence-based treatment and recovery practices as Assistant Secretary for Mental Health and Substance Use in the U.S. Department of Health and Human Services, and as the Administrator of the Substance Abuse and Mental Health Services Administration. She served as Commissioner of the Connecticut Department of Mental Health and Addiction Services for 6 years. Prior positions held at DMHAS include Deputy Commissioner, Senior Policy Advisor, and Director of the Department's Office of Multicultural Healthcare Equity. In her role as Commissioner, Dr. Delphin-Rittman was committed to promoting recovery-oriented, integrated, and culturally responsive services and systems that foster dignity, respect, and meaningful community inclusion. Through her 20-year career in the behavioral health field, Dr. Delphin-Rittman has extensive experience in the design, evaluation, and administration of mental health, substance use, and prevention services and systems, and has received several awards for advancing policy in these areas. Most recently, she has received the 2019 State Service Award from the National Association of State Drug and Alcohol Directors and the 2016 Mental Health Award for Excellence from the United Nations Committee on Mental Health. Please help me welcome Dr. Delphin-Rittman.
Good afternoon, everyone. Happy Recovery Month. Woohoo! Happy Recovery Month. It is just such a pleasure and honor to be here. Wonderful to see so many friends and collaborators and partners and folks that we know are just steeped in this work, and that we so appreciate the work that you do in, day out. With all of us to help to advance and promote recovery. I want to say a special thank you to Keegan and the Faces and Voices recovery team for bringing us together. This is always such a wonderful community that is formed here with this event, and just wonderful to be able to see everybody and to connect here for this luncheon. I hope you all join us this afternoon as well for the walk. because that will be another great opportunity just to fellowship and to celebrate recovery, right? To celebrate the 23 million Americans and more, and people really across the world who are in recovery. So really looking forward to that. I hope that you all can join us and looking forward to our time together. So this is what I'm going to do. So, it's been a year, right? It's been a year since we have been together, and my goodness, time flies. So that means that the Office of Recovery is now 2 years. 2 years old. And so want to share, yes, I know, I see folks clapping. We just thrilled for the Office of Recovery team, Paolo Del Vecchio, Michael Askew and the team are just in the zone, have been doing so much work over the course of the year. And we often say that, it takes a village, right? It takes a village to do this work, and we are so grateful that many of you in the room and, who may be watching online have been right there with us and with the office over the course of the year, whether it be attending the various convenings or policy discussions or, just the range of events when we put things out for public comment. So we so appreciate the ways in which all of you are advancing the work and the ways in which we're partnering and working together. So what I'm going to do, I have about 10, 15 minutes or so. I'm just going to share some updates in terms of work that's been done over the course of the year. Many of this will look familiar. It might look familiar to some of you because I think probably you participated in some of the meetings that I'll be talking about. And again, we are so grateful for everyone's participation. I know we often talk about, nothing about us without us, and that is definitely a mantra, a theme that we hold near and dear to our heart at SAMHSA, certainly a theme that is part of the work of the Recovery Office, and so we enjoy and appreciate the opportunity to reach out and involve everyone in the work that we're doing. So next slide. So I think the data slide is up. I have my printout, so I'm glad I brought it. But so I wanted to start with some of the data. Our NSDA came out earlier this year than ever, so we're thrilled about that. And the NSDA team did just an amazing job getting this data out early. And when we look at some of our recovery data, and do stay tuned because there will be a broader recovery report that shares more specific recovery data. But if we look at just this snippet, what we see is that in 2023, slightly more Americans are reporting themselves as being in recovery than the previous year, and slightly more than the previous year. So we know about 22 million Americans, or about 73%, consider themselves to be in recovery or recovered. And that is definitely a testament to the work that all of you do, the folks joining, just the work around the country to help advance recovery. And there's so much creative work that's happening in terms of peer and recovery support, recovery housing. The list goes on, and I'll share some of that additional work. Next slide. One thing that I'm really, really happy to be able to announce is that we get to show you a sneak peek of our gallery of hope. What we did earlier in the year is we put out a call and asked folks, send us your artwork, send us your depictions of recovery. And we've put that now together in a gallery of hope online. The artwork is divided into different categories. Next slide. And so you'll see the categories in terms of peoples or animals, sculpture and collage, photography. We received over 300 submissions. And it's just breathtaking. It's really, really beautiful art. So please, take time, take a look at it. If you go to the page, when you click on, so you'll see the different categories, and then if you click on any one of the pieces of art, let's go to the next slide, please, then you'll get a drop-down screen that will have some of the language that the artist put together that describes sort of the vision and the passion behind that piece. This is just one example, is by, Emily McConville, titled Out of Darkness. And I think, what Emily depicts in this work and what she describes, summarizes that, this describes her depiction of how resilience and hope can rise out of the depths of adversity. And it's just wonderful. And we're so grateful for just people sharing their artwork and sort of sharing in some ways themselves, right? And some of their experiences that was poured into that artwork. So do take a look at that. We're launching that as we speak. So by the end of this, it will be live, and you can certainly peruse that online. Next slide, please. We're also really thrilled to be bringing back our recovery-oriented systems of care guide. This is work that had been done in the sort of around 2012, 2000, maybe 10 years ago. It was quite popular. We've been talking about this across SAMHSA. There's quite a bit of work now that I think puts us as a nation in a different place to be able to advance this in ways that may have been challenging 10 or 15 years ago. And so really excited to be able to update the guide. There's work now looking at the past 10 years of research that ultimately will be summarized within this guide. We anticipate the publication will come out end of 2024. And then we'll work with states and assist communities around implementation, around really operationalizing what we mean by recovery-oriented systems of care. From a recovery perspective, or from a system perspective, and what policies need to be in place, what programs, what sort of recovery vision, and the different pieces to be able to promote and advance recovery from a systemic and a holistic perspective. So really excited about that as well. Next slide, please. I often talk about the village and how this work is, certainly can't be done alone, and it's wonderful. We love when we can bring different villages together. And so, and I'm not even sure if that's quite the analogy, but really it was wonderful to be able to do this convening this past year where the Recovery Office and CSAP, I think even CSAT was involved, brought together the harm reduction community, the recovery community, to really to sort of dig down deep and have that discussion around sort of what are our areas of commonality, what are some areas that what are our areas of difference? What are our areas of difference? What are some ways we could move forward together? What are some of our values and some of our, areas of similarity? So we, certainly one thing that came out of the meeting is there are common values. So, similar values, principles of choice as a commonality, the importance of voice, voice and presence and agency, definitely a commonality. Meeting people where they are, also an important commonality. And so there'll be a guide that will be developed and guidance developed around sort of these local partnerships across the recovery and harm reduction community, as well as cross-training, so training individuals across community in some of the approaches and principles and strategies of the others. So we're really, really looking forward to that work. And kudos to the Recovery Office and really to everybody that participated in that. We're so grateful for folks who participated. I think 3 days, was that 3 days, Paulo? 3 days, and stayed steeped in those conversations, which I understand got challenging at times. It was challenging at times, but grateful that folks stayed at the table to work it out, and so there will be some products moving forward. Next slide, please. We're also doing work around recovery housing, right? Because we know housing can be such an important grounding, an important piece, an aspect of recovery. It can be foundational. Having a place to call home. Extremely foundational. So one thing we're working on is just continuing to expand and improve recovery housing content, resources, information. Last year released Best Housing, which is best practices and suggested guidelines related to recovery housing. It includes about 11 different standards to consider and think about in implementing recovery housing. And then ultimately we'll be providing sort of training and TA through both our Center of Excellence, Recovery Center of Excellence, and also the SPARK, the SAMHSA Program to Advance Recovery Knowledge. The team went, I know I got it, right? Because it's so creative. Like, you guys went like all out on that one because SAMHSA Program to Advance Recovery Knowledge, really creative. And what that is a group of folks around the country that are doing recovery-related work that have come together and that ultimately will be providing training and TA, in collaboration with, in some instances, a Center of Excellence, but really continuing to advance recovery knowledge. And so really important initiative there. And then you'll see some of the other resources. We'll have a fact sheet that will be released focused on sort of equity, Actually, was that the next slide? Yeah, focus on, actually, next slide. I think I forgot to say that. But anyway, focus on equity, and so we'll continue a lot of that work. So next slides. Are we on the strengthening equity-focused recovery work slide? Okay. See, I got ahead of myself. Got all in it and got it. So equity. Right, we know that equity is such an important part of the recovery-related work, and so that is another area of work that the office is focusing on. The office has been looking at, did a convening related to American Indian and Alaska Native, along with and actually established the Behavioral Health Center of Excellence, and did a convening looking at sort of tribal areas within recovery and equity. Ultimately, we'll be developing a compendium of culturally responsive practices, so stay tuned. That will be coming out soon. Also a fact sheet, and currently working with Ohio, Oklahoma, and Texas in the area of sort of recovery housing, actually. Next slide. So the last area I wanted to end with is, before I talk about some of the activities we have coming up for Recovery Month, is the 988 Suicide Prevention and Crisis Lifeline. Just wanted to provide a quick update about that. I know we talked about that quickly last time. We're about 2 years in now. 2 years in, and what we've seen, about 10 million contacts have been made across calls, texts, and chats, and in some respects it lets us know folks are struggling, but at the same time they do see 988 as a valuable and viable resource to get support and to get help. And so really pleased about that. Please help us get the word out there. We have developed a toolkit, a resource kit that has content that is sort of equity focused, that's geared towards groups that may not be aware, may be underutilizing 988. But take a look at that toolkit and help us to get some of the information out. There are digital shareables that you can share on whatever social media that you're on, or you can take some of those and print them out, make them posters, however. But ultimately, we're interested in continuing to let folks know that it's available. As you see, in the past year alone, or past 2 years, there was 15% increase in texts, 34% increase in calls, and then we also saw about a decrease in chats. Which we know, may be in part because many people use phones, and the phone very much is a computer, and so, info may be coming in that way. The other thing we really wanted to share is on September 8th, which is next Sunday, we will be celebrating our first 988 Day. And so that is a day just to raise awareness, to create positive buzz around 988, to help get the word out. We also have digital shareables there as well, so take a look at some of those. Share them on your social media. If you've got any of the hats, T-shirts, any of the amazing swag that's out there, anyway, it's out there. If you go on like Amazon and type it in, pages and pages of T-shirts, amazing things. We're working on starting a foundation, trying to start a foundation so we can begin to develop some of those ourselves. But stay tuned, that will likely be down the line. But anyway, we're excited about 988 Day to be able to get the word out and help us there to spread the word. Next slide, please. So I wanted to end on just some of the activities that we do have coming up this Recovery Month. As you know, this afternoon is a walk, so please do, again, join us for that. And then the Gallery of Hope, definitely check that out. On September 24th will be the Trailblazers of Recovery Award, and that will be an opportunity to really pause and to honor the individuals in recovery that are trailblazers in the work, that are going above and beyond in the ways in which they're advancing recovery and meeting people where they are and giving people hope. So certainly stay tuned for that. And then from the QR code there, you can get a link to other activities that we have going on. There are a number of webinars happening. In fact, there is a webinar series. Each week has a different theme, so you can participate in those virtually, free of charge, and definitely help us, certainly participate in those and spread the word about those as well. So again, it is just such a pleasure to be able to celebrate Recovery Month with all of you. So appreciate the work that you do day in and day out. We love the partnership and just the opportunities to be able to sort of fellowship and to be in space and share space with you all. And hope to see you later on at the walk. So thank you so much. Appreciate the opportunity to be here.
Thank you, Dr. Delphin Rittman. It's a pleasure to be able to have you all here, and what exciting things coming out of SAMHSA. I mean, really, what a great idea to hear of a dedicated space, a day for 988. An important piece of our resources that I think recognizing is really critical. Coming up next, and appreciate you rolling with the punches as we eat and play together. That really appreciate as we kind of crunch time. But coming up next, we have another remarkable speaker who's been a steadfast advocate and champion within the recovery community. Garrett Haid. And Garrett Haid is a passionate advocate for addiction recovery and mental health, drawing from his personal journey and extensive experience working with leading nonprofit organizations. Co-founder of Mobilize Recovery, a nonprofit organization and collaborative initiative dedicated to building a nationwide network of recovery advocates. Launched through the Facebook Community Leadership Program, Mobilize Recovery identifies, trains, and connects individuals from across the United States and fostering a powerful and coordinated force for change in the addiction and mental health space. Garrett's also a dedicated grassroots organizer, working to empower individuals in recovery, family members, and allies to advocate for community-based solutions and policy reforms that address the addiction crisis. His nationwide advocacy work includes visiting institutions and communities impacted by addiction, championing better access to care, ethical treatment practices, criminal justice reform, and harm reduction strategies. He empowers others through education and training to break down stigma and advocate for change. Please give me a warm welcome for Garrett Haid.
Hello, good afternoon. I want to first start by also thanking Keegan and the entire Faces and Voices of Recovery team for having me here. It's really always a privilege to be able to share my journey, talk about recovery, and do it proudly, because that wasn't always the case for me. And this Recovery Month is especially significant for me because it's the first time I'm publicly able to say that because of my recovery, I am a new father. And thank you. Thank you so much. My son Cameron was born actually October 9th of last year. His due date was supposed to be September 30th, so I've already told him that he messed that up for me. But we've already begun talking about recovery. But honestly, out of all the gifts that I've been given, the gratitude and the pride and the joy at just having the opportunity to be his dad is immeasurable. Like Keegan introduced me, I'm the co-founder of Mobilize Recovery, and I will go over some of that work in a little bit. But I just want to acknowledge that probably many of you are very familiar with my other co-founder's story, Ryan Hampton. And maybe even some of you are familiar with the work that we do, but probably not so familiar with me and my story. I tend to stay in the background of the work. Public speaking isn't always the most fun thing for me. But, I just wanted to give you a little bit of my background. And unfortunately, my story of how I got into recovery is not very unique. Prescribed opiates at the age of 16, and that ensued a 12-year battle and struggle, which everyone in this room knows all too well. I'm grateful to be able to stand here with all of you today and say that my recovery date is March 3rd, 2015, and thank you. So just over 9 years, which is, remarkable for me to even think about 9 years. It's a long time. And as I look back on my life now, and obviously, I experience a lot of the same barriers that many of us in this room, but also, millions of people have experienced. I believe one of the biggest barriers, and why I'm always so proud to be able to share my story publicly and openly, is there was a generational silence around addiction affecting me my entire life that I didn't even know about. Just example, my father passed away in 2006. Alcoholism was a contributing factor in his death. I didn't know that fact until 2016. I didn't know that from the age when I was 6 until 16 years old that my dad was in recovery for 10 years. That's how silent it was within my family. Even when I was, looking for help and seeking help and going in and out of treatment centers, I was under the belief, and my impression of what recovery was go to a designated room at a designated time and speak with a designated group of people, and outside of that, you don't talk about this. That really changed for me in 2015, shortly into this experience of recovery this time around. Brian and I were sitting on a couch in a recovery residence in Pasadena, California, and we were it was really early. We didn't have nothing to do. We didn't have anything to do. So we were scrolling for something to watch on TV, and something scrolled across the screen that said anonymous people. And I knew that word, so we read the description and we watched it. And I believe from all the other times to this time, that was the difference for me. Seeing people out and open and talking about it and marching and advocating for different things and just being unashamed of their past, but also more importantly, being unashamed of their recovery, which is something that I really was, to me was the catalyst and turning point of why I believe I've been able to get to these 9 years. Now, true story of how we I have a little joke that I say Ryan cold called us into recovery advocacy because we saw, I'm sure everyone knows, but Tom Coderre in the film, and Ryan literally just DM'd him on Facebook, and Tom put us in touch with Greg Williams. Greg Williams put us in touch with, the McShin Foundation. The list just goes on and on and on and on. And within my first 18 months, and I wrote a few things down here, but thrusted into the recovery advocacy movement. I was on a 35-foot RV for a month with 5 men, and we traveled the country, and I went and understood what an RCO was because I visited the McShin Foundation. I was in and out of jail programs, harm reduction coalitions, treatment, and just soaking up as much knowledge as I could with the one goal of bringing back some knowledge to my local community. I started to distribute, I didn't know what naloxone was, started to distribute naloxone to any provider in my community that would take it, any recovery residents, started to train the people that were residents of those communities on how to respond to an overdose, started to advocate for medication-assisted treatment, and at one point, just to prove that this could be a voting issue, organized 100 people in our community to register to vote for the very first time, and started to, thank you. And I started to help and have input on drafting legislation and then testifying on committees around this legislation. I say all that to say I had zero experience with public policy, community organizing, how to use my story for impact. And for me, when I traveled that country on that RV, that was the experience of most of the people I met. It was they wanted to do something, they wanted to get involved, but really did not have the skills or even what I saw, the confidence or the permission, they were just like me. So that was the question. How do you take someone like me and give them the knowledge, the resources, and most of all, the confidence to be able to make that change in their community? And although we didn't have a name for it at that specific moment, that was what would be the birth of Mobilized Recovery. Just so I get through this, I'm going to fast forward to 2019 when we launched the first ever convening of Mobilized Recovery. And it was through a grant through, it was through Facebook, Meta. I try to correct myself, but I always say Facebook. It was through Meta, And it was 100 people, and we opened up an application process, and we asked individuals, what do you want to learn? What do you want to do? What are some ideas you want to bring back to your community? And we're able to select based on those answers, but more importantly, we were really looking for folks that had no experience in the recovery advocacy movement, had no experience with public policy, had no experience with community organizing. And you know, I know some of you folks in this room were able to come in, but we asked people who started RCOs, people that started nonprofits, people who had experience with public policy, people who had experience with working with the media, people who had experience with crafting public narrative, and asked them to come in, and we couldn't pay them, asked them to come in for free, and train these people with the sole goal of letting them build their knowledge and bring it back to their community and recreating what all of you in this room and many other organizations did for me and did for us beforehand. And, you know, there's a lot of facts and stats and data that I can give you out of that thing, but I think the one that's most important for me is out of those 100 people, for the most part, I still know them, I still talk to them, they're still involved. They, you know, some have started nonprofits, all are really engaged in their local communities. And I think it was just, you know, like me, just needed the permission and needed the confidence and needed the tools and knowledge to go out and do what they wanted to do. You know, just a couple milestones that we at Mobilize Recovery were able to cross last year. Last year alone, we were able to train in public and community organizing tactics 2,335 individuals in recovery. We were able to, thank you. We were able to, it wasn't all last year, but we crossed the 1 million mark through that coalition of individuals where we distributed over 1 million units of naloxone to communities who needed it for free. And something that was new last year that we launched, which is you know, pretty powerful to me, was the Nationwide Day of Service, and I want to get 47 states and 4 continents, resulting in 520 events, mobilizing 2,197 individuals to engage in community service on a single day, which was last year, which to me is incredible because, at least from my personal recovery, service is such a huge component for me to remain in recovery. But I also think that sometimes we need to let the outside world know that people in recovery can be of service. So the day of service, it was anything you wanted it to be. You know, volunteering your time in a shelter, doing a beach cleanup, you know, by yourself at a senior home and volunteering your time for the day, just to show the world that people in recovery have value, can contribute to society, and break down some of those barriers and stigma that we faced. This year, and this will be the second year we're doing it, we will be launching a nationwide bus tour. It'll launch on September 20th in LA and go through to DC in October 11th. And it will be 18 cities and 27 events. And I think before I just tell you a couple key things on the tour, I think the most important thing is to understand that every single one of our event is a collaborative effort. We have over 30 national partners, government agencies, and community organizers and individuals. We do not do any of this alone. The content, the structure of each event when you go into a city is completely crafted by local organizations and local community organizers, highlighting the issues that are affecting their community the most, solutions that they're providing to their community. And because of our partnerships with companies like Meta and Google and iHeart, we're able to amplify the voices and the work of the communities that are on the ground there. So sometimes the questions arise like, why a bus tour? And it's because we're able to reach more people over a shorter amount of time than we ever could by bringing a group of individuals into a single place. It's also just really cool because you can like write your name and messages of hope and inspiration on the bus, and as it travels from city to city, each city will start collecting those signatures and recovery dates and remembrance, and it becomes this massive megaphone of what recovery looks like as it travels across the country. I think, it was brought up earlier around like building bridges, and I think one of the really cool things that gets highlighted is just how unique each recovery community is. What recovery looks like where I live in Las Vegas, Nevada is very different from Cedar Rapids, Iowa, or Oak Ridge, Tennessee. And, one of the most interesting things to me is one day we will spend in Arizona. The first event, it is at a very faith-based, abstinence-based community organization there. And 20 miles away, the next event will be with the entire harm reduction community out in that city. So two very separate, two very different pathways to recovery. Both both communities were not really aware of the other one that close apart, and we'll be working together and attending each other's events. So it's like a beautiful way to bridge the gap between people that are so close. We'll host a few town halls that'll cover workplace initiatives, youth mental health, access to care, and just for the first time this year, which if anybody knows, it's not always easy, we'll be starting the tour at a public middle school, and we will be ending the tour at a public high school. So thank you. Working with schools is always an experience, and we're very grateful that they are allowing us to come in and be part of the kids. And the last thing I'll touch on is Mobilize this year was able to work to expand 6 different peer groups that are operating inside emergency rooms with a specific agenda on allowing peers to operate in rural communities, and we've been able to secure some grant fundings for these organizations to expand their reach. And during the tour, 3 of the stops will be highlighting the work that those communities are doing. I think when I started in this, one of the big things, and continue to this day, is they say, it's my personal experience that is needed, my voice, and what shapes public policy and effective public policy. And I wanted to just tell one quick story, and then I'll close. I was thinking about, when I was putting these remarks together, I was thinking about from the very first time I had to sit in front of a legislative committee and provide testimony. And I remember I did not hear a single word that was happening around me, and I had my paper in front of me, like glued, and I heard my name called, and I read word for word for word for word, and then I was done, and I was just sitting there quietly, and I couldn't tell you even back. I have to go back to even tell you what I was advocating for at that time. The last time I was asked to provide testimony. And I think this is just a testament to the work that everyone in this room does, and the confidence you all gave me to be open. There was a bill being passed or being proposed where I live. It was around creating trafficking charges for anyone carrying 4 grams of fentanyl or more. And there was a big hitch to it. It was they couldn't discern what amount of fentanyl could be in a product, so you could be caught with 40 pills, one's laced with fentanyl, you go to jail for trafficking. And at one point in time, and I think it was the co-sponsor of the bill, and again, I was prepared, I had notes, I had stats, I worked with people, I knew what I was gonna say for 2 minutes too. At one point in time, someone said, there is no reason anybody should have 40 pills on them unless they are trafficking drugs. And I heard it because I was listening and I was confident on what I was going to say. And I did not read a single word I wrote. And I just started my testimony with saying, here are 3 examples of somebody who carried 40 pills on them and was not drug trafficking. And that person was me. And all I could end up with saying was, thank God you did not propose and pass this law, because you would have deprived me of a life, and you would have deprived my son of a life who's about to be born in 3 weeks at that time. And, that bill was killed, and in my mind, I like to think that they went to the back and they're like, he made the most sense, but, thank you. But I think, I always try to keep that forefront in my mind of, my story does have the power to affect public policy, and I can change things. I will close with this. You know, I started by saying because of recovery, I'm able to be a father today, right? But it's because of recovery advocacy and all the work that all of you have done and the administration has done and just the decades of work that organizations have done to tear that down, that allows me to know that, you know, like, I don't know if my son will ever struggle like I did. I have no idea. But what I do know for a fact is he will not struggle in silence, and he will not be of fear to go to his parents or friends or community and say, I need help, or my friend needs help. And the generational silence in my family, because of all of you, has been broken. So thank you all so much, and thank you for having me here, and happy Recovery Month. Thank you.
Garrett, thank you. I was struggling walking up the stage, and I was like, hey, you have to speak now. You can't cry. Jeez, Garrett. Yes, you can. There you go. So really appreciate the remarks and the generosity for you to share your time here with us today. I'll say that as an organization, Faces and Voices has been a partner of Mobilize Recovery, and we continue to participate in the Recovery Day of Service. And for us, we try to build up the hype on International Recovery Day, to commemorate the observance. But one of the cool things that we do as an organization is ensure that our staff are comped volunteer time to be able to go out and participate in the Recovery Day of Service. And so if that's something that you all are interested in doing, I always highly encourage you to advocate for your own needs. One thing that stuck in my head earlier today is that I was recording a podcast, and so stay tuned. But I was recording a podcast, and one of the questions was asked was, kind of what's one takeaway that you really think people should have related to advocacy? And not unlike Garrett's experience, it's been that really ensuring that the voices are heard. I have to remember that the hoop to jump through to get started into advocacy work is so much bigger than I initially thought it was. I assumed that this was something that was very restrictive, and that I had to have a law degree, or that I had to have all of this exposure prior to sharing my voice, and it turns out it couldn't have been farther from the truth. All of those things are very helpful, but they certainly aren't requirements. So thank you, Garrett. Our next speaker, excited to be able to introduce another pivotal figure in the field of substance use disorders and recovery, Dr. Felicia Poulin, who is a qualitative researcher with expertise in the application of critical race theory to understand the impact of racialized drug enforcement policies on the ability of people of color to attain recovery capital. She also designs integrated conceptual models to explore the intersection of race, structural racism, and addiction among people of color who use drugs. She aims to establish political, social, economic, and health equity for people of color who use drugs. Her seminal work in the field has been recognized by OASIS, who's the department out of New York, SAMHSA, and the CDC, and the New York City Department of Health and Mental Hygiene. Mount Sinai, REACH, and others. Please help me welcome Dr. Felicia Poulin.
I hope I bought my real glasses because I can't see a darn thing. But it's really good to see so many family and friends. Oh, there you are. Here. Good afternoon, recovery family. It's really great to be back at this recovery luncheon and the kickoff for the recovery walk. I did bring my sneakers this year, but you got to admit this is a great pair of heels. The good news is I did bring a script, thank you. I did bring a script. And the bad news is I usually veer off of the script. So I'm going to try and do my best to stay on task. I'm really inspired to be here and to participate in this recovery conversation. I am excited to be here with so many activists and advocates and boots to the ground people who inspire my work, the policymakers who work tirelessly and fearlessly to give us the tools that we need to do what we do, and with the family members who are loving people in addiction. Sometimes they lose them, and sometimes they love us into recovery. So I'm really humbled to be here. I'm going to try and get through what I brought to share with you. And if any of you have known me or seen me speak before, you do know that I can cry getting through some really tough data. And so I say data, and I don't want you all to just fall asleep. I want you to know that the data that I bring you is qualitative data. My story is woven within the stories that you will hear from people of color who are currently using drugs in Harlem. My button says that recovery is self-defined, so that means that it is not only abstinence. And I want you to see my face and hear my voice as you are hearing the voices of the people of color from the community that I'm with. And so it could have only been God that brought me here and turned my test into a testimony, even if he did use Patty McCarthy and Keegan to get me up on the podium. I'm grateful. I'm grateful that I'm on this side of the law. I am grateful that I am on this side of my mental wellness. I'm grateful that I am on this side of my life after decades of drug use, and so how could I refuse? And so for those who are wondering, yeah, the doctor part, but it's more important to get the Felicia enunciation. People who know me know I'm just a stickler about that kind of thing. But I am really most proud to say, just kidding, Keegan. I'm really most proud to say that I am an unapologetically Black woman in recovery. I'm also a mom to two brilliant and funny and talented kids, and they still want to hang out with me despite my years of active use. I'm soon to be an ex-wife, but that's a story for the next recovery luncheon. I am the daughter to many and a mother to some whom I did not birth, and I'm friends with some incredibly supportive women with whom I laugh and I cry. Professionally, yeah, the social worker and the social scientist and all that other stuff, but those are not the pieces that are really important to me. They just are the tools that allow me to do the work. I am very similar to those that I serve because I also am in recovery from suicide attempts, from self-loathing, and self-aggrandizement. But important to today's conversation, I'm a racial disparities disruptor. So it's not just my own story that I wish to emphasize today. I'm really here this afternoon to lift the voices of those without the privilege to be here, those who were not invited to this beautiful space to dine beside us on the delicious salad and lovely chicken, because they were not here to share their own stories personally, and so it is my job to do that for them. And so many of us here are leaders in the field, and as much as I am one of you, today I am here as one of them. A Black woman who smoked crack, neglected her children, lost her will to live, and wanted to quiet the noises in my head by using drugs. So you're going to hear my own story alongside theirs. And my hope is that the threads between them and me will help you to understand that despite every tenet of recovery capital that people of color who use drugs have been able to acquire, negative recovery capital has more gravely impacted us and prohibits many from reaching their recovery goals. And I want you to see them, and I want you to hear them when you look at me. I want you to feel that collectively we can serve and support and create policies to assist them in their recovery journeys. But you need to hear their voices and listen to their definitions of recovery first. So I had the honor over an hour of time with each individual to ask them several questions. And so one of them was, why do you think you began using drugs? Predominantly, the answer was riddled with childhood trauma. I was 8 years old. My mother went to a party and left my brother to watch me. In the process, he beat me up and he raped me, and I couldn't tell anybody because at that time, you just didn't. I seen my mother get killed, and I was a little girl. I was 5 years old. I remember walking through the door, and he shot her in the head, in the back of her head twice. Then he turned her around and shot her twice in the chest. Later on her back, wrapped her body up, and put her on me and my brother and my sister. Me, I was sexually molested by a neighbor and emotionally, physically, and spiritually beaten by my mother nearly every day. So historical reflections often came through with the relationships with parents and siblings, and they were frequently permeated with drug use and drug culture that also contributed to their own perceptions and experiences with substances. My stepfather owned a bar in Brooklyn. Not only did he own a bar, but he also sold heroin out of his bar. I was intrigued by his lifestyle, the diamond rings, the jewelry, the women. My sister introduced me to heroin. I wanted to know what it was all about, so I tried it. My mother used drugs around me with her friends at the table, and I would sit with them and smoke weed and do cocaine and drink alcohol. And I felt so grown up being at that dining room table with them. More than half of the people that shared said that the average age of substance use initiation was 15 years old. It was fun. I started getting high when I was 13. I ran away from home. I've been on the street since I was 13, running back and forth in and out of institutions and places and things. I was 17. A friend of mine had some cocaine and he cooked it up and asked me, did I want to try it? I did. That is why I have never used any other drug. I was 13. My mother gave me my first joint, told me to go in the room with my girlfriend and that she would rather me get it from her than on the street. One of the questions that was really curious for me to know was, what are the benefits of drug use for you? The desire to feel better was cited over and over again. Honestly, I guess an opportunity to just numb that pain again. When I wanted to relax and come down to natural, I have to get high. The benefits of smoking and using heroin is to manage the ups and downs, the highs and the lows. These are all answers that I completely understand. I used drugs so that I didn't have to continue to conjure up the smell of the cigarette breath of my neighbor before he kissed me, or the sting of that white belt with metal grommets that my mother used. Often, and I was only 7. So let's talk about the good news. Let's talk about the definitions of recovery and what recovery means to people. That was a question that I was so interested to know because it can't all be about the bad. Recovery to me means stopping completely and getting my life back in order. Recovery? That's a big thing. It's like the combining of all the things you've learned, and you're getting better mentally, physically, emotionally, being able to handle problems better than you've ever done in the past. Rebuilding your life, rebuilding what you lost, finding a healthier way of living. That could be your mental health, your emotional stability. It could be your materialistic things, work, harm reduction, staying active, keeping my mental, staying in touch with my family, not having people in my house, making sure that I test what I have to use, drink water, and don't go overboard. I think about it. I keep myself not using as much as possible. I actually minimize it or get control of my behavior. I'm constantly trying. I don't think I'm going to stop right yet. I'm having a lot of stress. I'm slowing down. As much as I came out, I used a harm reduction approach. That's my recovery tool. Making sure when I use fentanyl test strips to test it for fentanyl. I just don't go overboard. And what are those pathways to get there? A significant majority of people indicated that talking with another person with lived experience had been most helpful. Others mentioned the importance of positive social and cultural connections and that capital that they built, which helped them to recover. Some expressed the need for advocacy in the treatment, recovery, and harm reduction fields to reduce stigma and to improve the science. What you're doing right now is really great. I get a chance to talk to somebody. I've told you things I've never told anybody. We need advocates. I love talking with somebody. I'm quiet. I don't speak to nobody when I'm around my kids. I never cried. I never did nothing but left it alone. And I think it's bothering me as I get older. When I see somebody who did it, I know I can do it too. Recovery is just like taking a break, regrouping, and getting refocused. You can do recovery even in using, but curbing your use and taking care of your business, that's how I recover. I don't go too far and do too far left anymore. I get up and I go some places. I got some place to go. I'm not outside in the cold and in the rain. To put everything back into place. Everything back where it belongs. Everything that I done messed up, stepped over, stepped around, stepped on, threw out the window, put in the garbage. Recovery is everything that I'm supposed to have. Don't kill myself doing it, but go for everything that belongs to me that I done let drugs took from me. Family, that's all. Family. But for me, recovery is hanging out with my children and watching a movie that I don't give a damn about. But because they want to see it, I am there and I am all in. Recovery is cooking a great meal and eating it with my friends. It is laying in the sun and listening to the ocean. Going to the gym. Okay, that's a new one I just added about 2 weeks ago. Walking into my home and taking off my shoes, recharging and feeling safe. So recovery family, My goal here today was to shift our mindsets from telling an I am in recovery story to sharing the what, how, who, and where we journey through recovery together. I aim for us to move away from sharing my story of success to our collective and shared journeys in the recovery community. I want us to understand that it is our shared responsibility that builds bridges between us. So please take a second. Think about which bridges to recovery you're building and which you may be tearing down behind you that no one else can cross over. I'm asking you to build a bridge between recovery and harm reduction and every other method on the continuum of care, so that we can all cross over into our own forms of recovery, if we so desire. I'm asking that you build the bridges specifically in communities that have long been left underwater, those with people of color who use drugs, who are not seen as worthy or deserving of a life jacket, a boat, or a flotation device. We all saw that on the news, right? You may need to be the life preserver, to see them as worthy of the benefits of being on the side of the bridge that you are on, at these tables, enjoying this salad and dining alongside us so that they can tell their own stories. It's National Recovery Month, and we all deserve an equitable chance to live. May we forever commemorate this day with the intention of building a bridge for another person to cross over from International Overdose Awareness Day into National Recovery Month. Thank you, Faces and Voices, for the opportunity to stand here and to speak with you today.
Thank you, Felicia. It's as we near the close of our program, it's my honor to introduce our final speaker, Paolo DeVecchio, who's the director of the Office of Recovery, where he provides leadership for SAMHSA's efforts to advance recovery across the nation. Includes expanding the availability of recovery support services, including peer services, housing, employment, and whole health care to people with mental health and/or substance use conditions and their families. Previously, Mr. DeVecchio has served as SAMHSA's executive officer and director of the Office of Management, Technology, and Operations, and led improvements in the areas of human resources, information technology, ethics, and more. He has also previously served as director of SAMHSA's Center for Mental Health Services, providing executive leadership for federal efforts to improve the nation's mental health and service systems. This includes management of the federal state mental health block grant program and directing a range of programs and activities that address topics such as suicide prevention, children's mental health, homelessness, disaster, mental health, HIV and AIDS, and others. A person in long-term recovery from mental health conditions and addictions, as well as a trauma survivor, Mr. DeVecchio has over 40 years of behavioral health experience as a consumer, family member, provider, advocate, and policymaker. Please help me welcome Paolo.
Good afternoon, everyone. Happy Recovery Month. I am a proud person in long-term recovery. My October 11th, next month, will be 40 years for me. Add my thanks to Faces and Voices and wish Patty a speedy recovery. You know, I have often been quoted as saying that recovery is patriotic, and since we're in Washington, D.C., right? And that's my bumper sticker. Because when you look at how SAMHSA defines recovery, that we talk about it being a journey for people to improve three things: their health, to improve their independence, and to strive to reach their full potential. So when you think about these concepts of health, independence, full potential, it's life, liberty, and the pursuit of happiness. So recovery, in fact, is patriotic. And we know, of course, that these journeys are some of the hardest journeys that we face. That time and time again, from our addictions, from our mental health problems, oftentimes from our very systems, that we are beat down. And finding the energy, finding the resolve to get up time and time again takes incredible strength and courage for people. We have to acknowledge that and celebrate it. And that's why we're here for Recovery Month, is to celebrate that journey for people. That you fall down 7 times, but you get up 8. We celebrate this journey with our allies, with families, with providers, with our friends, our neighbors, our faith community members, and others. We also know that it's about finding hope and healing, and hope, as we define it, as the catalyst. It's that factor that helps us get up each day and put our socks on, come to the office, do what we need to do to help advance recovery across the nation. And taking that catalyst, that seed of hope, is what our work is about, is to give folks that seed that there can be a better life for us as individuals, as families, as communities, as a nation. And that does take action. And that's, when we start our journey, when we continue our journey, it takes us to act. And, we take control of our lives when we act that way. And for us this afternoon, we're getting ready to act, because in a few minutes, we're going to be joining our 2nd annual National Walk for Recovery. And so when we do leave, here's just some logistics. When we leave this incredible facility and exit on 14th Street here, we will be walking south, right? Got it? South, just 1 block. Freedom Plaza is 1 block to the left as you come out of the building. 1 block. So we'll be starting at 2:30 with several speakers to get us kicked off, and a performer or two, and then we'll be walking from Freedom Plaza, it's appropriate, to the Washington Monument. Sylvan Theater there, it's about a mile walk. Should take us about a half an hour. We'll convene at the Sylvan Theater at Washington Monument to begin a program there at 3:30 with a bunch of speakers and performers, and to have some fun and have a great celebration. So we really encourage everyone to join us to act, in fact, for recovery, and walk with us. Thank you, Faces and Voices. Thank you all very much.
Thank you, Director. As you can hear, the fun doesn't stop after the event of the luncheon. We're excited and invite all of you to be able to continue out. What a great, incredible lineup of speakers we've had. What an amazing time that it's been being able to be a part of this with you. Let's give another round of applause to all the speakers for today. Thank you so much as we've been able to kick off Recovery Month with you. Be sure to take this spirit of recovery with you as you navigate your journey throughout September. Engage in lively discussions, hopefully several uncomfortable ones, all where we have opportunity to continue to educate and advocate for the welfare and rights for people impacted by substance use disorders. So thank you all so much. We'll see you next time.